Welcome, everybody. Welcome. Hey.
Hi. How are you?
Hi.
So excuse my voice. I'm so sick. So I'll be coughing every 5 minutes, but it's pretty bad. Yeah.
Okay. It's okay. I'm trying to add Gigi and
And
Tamika.
Tanika.
Yes. Let's
Awesome.
see if she's on here.
They have to request.
Oh, they have to request.
Mm-hmm. Hi guys.
Hi, everyone.
Welcome to our live.
Welcome. Welcome. We're waiting on two more of our team members, and then we will get started.
Let's see. Guys, we pinned the link to the Discord at the bottom of the live. This is where you can join the community, the CSL community. So if you are not a member, if you want to join, if you want to get familiar with what we do and the whole community, you can click that link as well. I really wish I did my lips again.
Mm-hmm. Okay, so let me add her.
How do we wait everybody?
I just added. Hmm.
Not working? It should be able to come on. Does it accept?
Mm-hmm. I invited.
Mm.
Okay, invite.
Maybe I have to invite one. I don't know. Let's see. No, I
Right.
can't.
It won't let you?
No, I don't even see the girls on here yet. I guess I can't see because I'm not the
The host. I
host.
see it say I'm trying to join. Wait, let me
I
see.
see her. No, it doesn't let me. That's weird.
This I know it can be more than two people on here.
Mm-hmm.
Cause I see them.
Share this live with others so you can watch too. No, that's weird.
Right. Okay, let me invite. I'm inviting again.
Mm-hmm.
Hmm. Let me see.
Yes.
Oh, can y'all
Request.
ladies, try to request to join the live. Request it because it's not letting me add you. Okay, let me see. You have no.
No.
No, 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 no. Can you? Well, you already on here. I'm trying to see what it would look like to request to join somebody's live.
Want me to get
Thank
off
you.
and try
Okay,
again?
wait, we got one. Here we
Okay.
go.
All right. There we go.
Hey, Gigi.
Hey,
I
girl, that was a
know.
disaster.
I know.
But
I'm
it
just
never
glad
goes
y'all on
smooth.
here.
It never goes smooth.
Yeah.
It's okay. It's okay. We in here. We let me wait on Tamika. I'm trying to. I don't want to start without her.
Okay. Yeah, she put in the WhatsApp that she's trying to
Yeah.
get into.
Okay, Tamika. I know you're on here. Request to join. Request to join the live, cause it's not letting me add
It's
you.
gonna be where the comments are.
Yeah.
Can you guys hear me?
Mhm.
Okay.
Yeah.
Hmm.
Okay.
We can hear you really well.
Just making sure because my speakerphone doesn't work very well. So I was hoping that it didn't affect the live.
Oh, it's good.
So sorry about the coughing.
It is good. Okay, here she go.
Mm-mm.
Hey,
There we go.
ladies.
Hey y'all,
We got all the
Hi.
crew in here. How y'all doing?
doing good.
Good.
How about you?
All right. So now we can start. We want to thank everyone for tuning in and welcome to our first live.
Woo woo.
So we are the CAHS department of the CSL organization, and what that stands for is Commission of Aesthetics, Health, Safety. And so we are a group of post-op specialists from around the world who have been meeting weekly to collaborate with our experiences, our uh everything we know, and to kind of get different, to create different protocols and guidelines for the post-op community. So I am Crystal Holland. I am the owner of Nature's Truth Therapeutic Solutions in Houston, Texas. I have been a lymphedema specialist for 10 years, and I have been a post-op specialist for the last 7. So I'm going to let the ladies introduce themselves.
Hello. So I'm Tamika Tardy. I am the CEO and founder of Massages on the Move. I'm located in Hendersonville, Tennessee. I have been in massage therapy since 2020. So I am also CSL Therapy's agency officer for post-op endure. So happy to be on board.
Yes.
Want to go first?
Mhm.
Sure. Go ahead. I can go
Okay.
first. Yeah.
Okay. Go ahead.
Dawn. I'm Gianna. I'm in Gianna Gomez, one of Aesthetics in Tampa. I'm going into my 6th year of business, and I've been doing post-op body contouring since 2019. I've been working with Ty for quite a few years, even in the baby stages of CSL. So she's been a big mentor, and she's an amazing person. So I'm really a part of this group, and definitely excited to be share our knowledge with you guys. So
Absolutely.
Hi, everyone. I'm all the way from Canada. So all these ladies are from the US, but I'm coming in from Canada. My name is Adia Garcia. I'm the owner of Trust Beauty Bar, and I've been in business for about 6 years. We specialize in medical aesthetics, but also post-operative care. I am the Canadian Commissioner of Aesthetics, Health and Safety, and I'm really happy to be here. We've been working together for the past couple months, and it's been great. So much to learn and so much to educate all of the ladies in the community, and I'm just happy to be here. So,
Absolutely, absolutely. Okay, so if you do not know, CSL, we have a protocol where we break up the post-op recovery process into 3 different sections. We have incisional sciences, we have post-op endure, and then we have body couture in the maintenance phase. So today we are going to discuss the incisional period. We're going to discuss, what we know, the myths we heard, and then we're going to allow you all to ask us questions. So,
mhm.
ladies, how what is incisional sciences?
So I guess wait, go ahead. Gigi, go, go.
no, obviously it's day 1 to day 7, and meaning
Mm,
after surgery is when, if a client is, local, or, a doctor nearby, usually they're going to come to you the day after, where their incisions are already open from surgery. We're not creating incisions. We're taking advantage of the incisions that are already open and draining them from those safely, and with the right protocols from day 1 to day 7. Doesn't always last a full 7 days, but it's
yep,
usually day 7.
yep,
And there's a lot of misinformation and a lot of back and forth in the industry, which is where CSL is coming to, bridge those gaps, clarify things, and actually set guidelines. So, but it's something that we all do. And if we didn't do it before, we're probably doing it now.
yep.
Right.
it definitely helps, and it's super beneficial. I mean, I know all of us probably have some clients where we don't do it. It all depends on when they arrive to us as a post-op person in their,
Mhm.
you know. So me being in Tampa, I'm close to Miami. Some girls leave Miami early and get to me sooner, or some local Tampa girls will obviously go to Tampa surgeons and then they're with me day 2 surgery, which is day 1 of the incisional journey. So
Yeah. I think
whatever
it's
you.
important to explain to the girls on here. We've all been working with clients at day 1 to 7. We just didn't have a name
Right.
for
Right.
it.
Right.
So CSL's, the women in CSL have come together to create guidelines, because a
Yeah.
lot of women started off just doing it. However, we learned whether it was
Right.
correct or not.
Right.
I think giving yourself those stages and understanding where the clients are in their journey of recovery is so important. And now it creates more clarity, right? And we're also educating the surgeons on how we determine where clients are, right?
Right.
So,
And
Right. And then the thing is that what I like about it is a lot of times we hear what we shouldn't do
mhm,
with from people that don't have experience in doing it. So we're here, we have experience with it, and we know that it does work and it is effective. And
mhm,
we're recommending that first of all you be trained, but you add that to your protocol when it comes to helping your client
I-
recover. Tamika, was you gonna say
no,
something?
no, I wasn't. Go ahead.
Okay. Okay. So, Gigi, you kind of went into my next question when I said, when I was gonna ask how long is the incisional period? But I want to hear from you guys. What are some of the greatest myths? Now, this is something that we really need to dive into because it's a fight out here. You have people saying, "Oh, you shouldn't do this." They're not telling people why. They're spreading inaccurate information on how the process is done. So, what are some of the greatest myths that you have heard when it comes to the incisional portion of recovery?
Well, I'll go first. Of course, we've all heard the horror stories of ladies coming back from these massage hubs. I'm sorry, these surgery hubs,
Mm-hmm.
uh, with horror stories about their massage experiences, which is usually day 7 of the incisional phase,
Right.
and they're screaming. It's hurting them bad. So the myth is that you have to have this deep, deep pressure when
mhm.
applying this treatment, and it's like.
That's not true.
Heard these stories and it's just awful, and I feel bad for them. Like, why would you let them do this to you? But
Right.
that's definitely a myth I think we should address.
Yeah.
Right.
Yeah.
Deep pressure. Do anybody else have anything? What are y'all's?
I think that comes from like clients coming from Colombia or Dominican, like they're used to very aggressive surgery, so a very aggressive approach to post-operative care.
Mm-hmm.
And so clients come here after having 20 massages there and they're like, "Oh, well, this is not what I was getting there." And we're
Why
like,
we don't know
"Well,
what we doing.
yeah,
Yeah,
so we
you
look
right.
like we don't know what we're doing. Like even like to go into another myth after is like reopening the incisions. They want you to reopen them and you're like, "Well, you're past that time." So
Yeah.
it's about the inconsistent information for clients and for providers,
Right.
you
Yes.
know?
And so that's why we thank God for CSL because it is
Yes.
bringing order.
Yes.
Everybody, I think I'm going to be honest, like 2 years ago, everybody was doing their own thing. It was no, so I was glad when and I had to be a part of this
Yeah.
because I was glad when Ty created something that was going to bring a protocol. You know what I'm saying? So everybody can be on one accord. So if
Right.
I send my client to you, you won't be doing something that's gonna make me look like I don't know what I'm doing
Right.
because nobody has a guideline.
Yeah.
So that's the great thing about this organization and about what we're doing. We're creating resources so we all can have the same answers so it can actually make sense because I'm just putting myself in the patient's or the client's shoes. If I have my surgeon telling me one thing, then my massage therapist telling me another thing, then the other massage therapist telling me another thing, it's going to add more stress to a already stressful process.
Yeah.
So that I really love what we're doing.
Yeah.
The biggest myth that I've heard about incisional and what is the is that you have to reopen incisions to perform it. I don't know where people is getting their information from, but I've never reopened anything. We only do incisional during day 1 through day 7, and 9 times out of 10 the incisions are still open. So I know a lot of people, that's their claim to fame. You shouldn't be reopening incisions. We don't. So y'all can take that to whoever, but we do not reopen anything. We do not promote that. We flow with the body's natural healing processes. If your incision is closed, you're not going to be getting incisional. So we just want to let you all know that. If it's a therapist on here, if you want to tell your clients, hey, we if it's closed, we can't do nothing about that. We got to move to the next
Right.
step.
Yeah.
And
So
that
what?
doesn't always isn't
Go ahead,
necessary.
Gigi.
It's I just want to say that it's not necessarily detrimental to their recovery. If, for example, a doctor sends a client or patient with sutures, or they're using that bonding glue or whatever to keep them closed, that's a sign from their surgeon. They obviously don't want you to reopen them.
Yeah.
Right.
So we're not going to force it.
No.
Obviously, if it's already there open, we're taking advantage of that and helping to get rid of fluid.
Right.
I think to lead into something else, one of the other myths that I wanted to bring up in the chat, but I was with clients earlier, so I really couldn't keep up with what we were doing earlier.
Mhm.
But is what comes out of the incisions. A lot of the confusion in the
Mm-hmm.
type of fluid, right?
Yeah.
It's not actual lymph fluid that's coming out. We're also pushing
Message.
the tumescent fluid that they use during the surgery.
Yeah.
Mm-hmm.
Um, also causes more swelling and stuff. So there's that confusion as well, that we're not actually pushing lymph fluid out. We're pushing other fluids out. So
Exactly.
Yeah.
Exactly. And that's why I'm gonna say it again. I think I'm gonna keep saying it. That's why I thank God for this organization, because it's bringing so much knowledge to incorrect information that has been thrown up to people looking to get surgery. Like, we're not pushing out lymph fluid. You cannot push out lymph fluid through an incision. It has to go through the body, and we know what we're talking about. So, yeah, Gigi, I like that. Thank
I
you.
just
We need to help that.
do it because a lot of people don't understand there isn't a post-op school. A lot of us learn
Yes.
along
Yeah.
the way.
We learned
Right.
So
Yeah.
along the
now
way.
Yeah.
we're
Yeah.
creating. Even some of us, unfortunately, were taught some of the wrong things that
Yes.
down the road with more research, we realize, you know what, we don't really got to do that,
Yeah.
or we don't have to go that way,
Yeah.
or
That's too.
safer to do this. Because I also would see people a few years ago getting drained at 3 weeks.
Yeah.
I'm like, what are they draining 3
Yeah.
weeks? And why are they reopening you at 3 weeks? So because they were an influencer, everyone wants to follow what that girl's
Yeah.
doing because she
Exactly.
results. And now,
And if you're draining, if somebody is reopening your incisions and draining you at 3 weeks, I
Right.
guarantee you they do not know how to do lymphatic
Right.
correct.
drainage. They went to
I think.
YouTube University.
Yeah.
So
I think that the
Go
clients
with
just need to understand that there's another way for you to be drained. Like they need to understand the process of the lymphatic system, and clients are not
they're
educated on that.
not.
Not that's not their fault.
right.
It's that there's an inconsistent message between the surgeon sometimes and when they get to us. So they automatically think, well, the fluid has to come out of somewhere,
Right,
right? And
right,
so
right.
yeah,
It's just a lot of misinformation, and
yeah,
that is why, if it's any therapist on here who is not a part of CSL, I really encourage you to join. This is going to help you. This is going to help your career, and it's
yeah.
going to help you help your clients. But yeah, so what would you say for those people who don't believe that we really need incisional? What differences have you seen in somebody who's had incisional drainage versus somebody who does not get it? What are your personal experiences when it comes to that?
Just the
I
healing process,
the
I
healing
think.
is different.
Yeah, starting that healing process as soon as possible aids in a speedy recovery, of effective treatments and things like that. It's like when you're playing catch up when you wait after that period, or
Yeah.
just want to use, like Gigi said, to your advantage, whatever you can,
Hmm.
you know, and it's safe, and of course offering post effective post-op treatments
True.
Right.
Yeah.
afterwards, of the incisional stage. So
Here
it's very
Yeah.
here in Canada, a lot of the surgeons don't even recommend it to clients. So I get a lot of clients that are coming to me 2 weeks, 4 weeks, 6 weeks. Oh, my surgeon said I didn't need it, and it's like I'm delayed now in how you're healing because you're coming to me with fibrosis already formed,
Man,
contour irregularities. So I'm doing double the work,
you make
right?
my
And a lot of the
yes.
times, yeah, a lot of the times the clients have had to do their own research. So if there was a consistent message from the surgeon, then we'd be able to give the client the better knowledge of what they need to do, right? Surgeons, I think, in my opinion, should be incorporating post-op right at the time when they're selling the surgery.
Right,
Like, this is your surgery, and
mhm,
here are your 20 massages. In Colombia, you already have that lined up,
right,
and that's why the results, it's not magic that the results from Colombia come back much better than some of the surgeries here in Canada, because surgeons there know the benefit of post-operative
right,
care, right? We're
right.
over here, we're seeing the clients sometimes 3 times a week for
Mm-hmm.
months. And that's
Right,
not
right.
just because, it's because they need our care,
And,
right?
and
So,
yeah. And I feel like people have to understand the medical field. In the medical field, you're gonna learn everything generally. The surgeons know the body, but when you are a
inside.
specialist, that means that you have taken extra courses. You have went above and beyond the general knowledge. And we have to understand that when it comes to post-op care, most surgeons have general knowledge.
Mm-hmm.
So that's why the program the organization is good, because we incorporate giving information and educational resources to surgeons as well, because it's not their specialty. Surgery is.
Yep.
So we have to be the ones to kind of suggest, because they surgeons, so we can't try to tell them anything. We have to
Yeah.
suggest, hey, this is our experience, this what we we have experience in this area, and us doing this and this is going to help your work look better.
Right.
Yes.
So
We're
when
matching,
I right,
Yes.
right.
and it
So when
Exactly.
I
look
what you say?
us on your team,
Yeah.
As
Right,
that it's like a team effort. They pass like what's baton to us, right? So we take over. So the more that when they're passed on to us, whether they're coming, like for example, to Ida in Canada, if they're coming all the way from Miami, by the time they get to her, they're 9 times out of 10 not week one. So if week one was already bad, in week two we're already
You're
starting
playing
to
catch up. You're
yeah,
playing catch up.
right,
will cost the
right.
patient more money, which means more corrective treatments.
Yep.
And you end up staying in foams longer, in things that should all have a gauge or a time.
Mm-hmm.
And I think
Mm-hmm.
Colombia is, yes, they're more aggressive, and I feel like what CSL is discovering, that the technique, although different and more aggressive, it doesn't have to be. And
Yep.
now we can do it gentler. So that's why, yeah, they get great results, but those girls over there are traumatized because when they come, they're
They are.
my table. Like, it ain't like that. Trust me. They're like
Yeah.
in heaven.
Right,
Right.
Um, but again, educating them is important, because then it's like we're telling them why or what we're doing, but sometimes explaining the why helps them relax. Like, okay, that makes sense. You know what I'm
Mm-hmm.
saying? So
right.
Mm-hmm.
why?
Mm-hmm.
Like, I'm not telling you this because you're paying me for a package. I'm telling you because it works. There's a
Yep.
method to madness, and I think
Right.
all of us developed a technique that we know works, but CSL is kind of bringing that together now and actually creating a protocol. And I feel like when the surgeons get on board, they're just going to realize, wow, we've been needed them on our team. Like, we're
Yep.
not here to
Right,
take anything
right.
from you. Like, and if you really get your team on board, it's game over. You know what I'm
Yep.
saying?
Exactly.
So,
And one of the things that we were talking about, what differences we notice
Mm-hmm.
in someone who has incisional and doesn't. From my personal experience, I noticed that the tissue integrity is a little bit more puffier.
Mm-hmm.
It's like, I want to say, it seems like, because the lymphatic system is located directly under the skin. It has it's more puffier. It's really more puffier when you
Like a
don't
sponge
get the.
there, like
Yeah. It's
spongy.
just
Yeah,
spongy.
Hmm.
they
yeah.
do. They harden. I feel like they if we leave it,
Yes, very much
Yeah.
they
so.
get hard
Yeah.
a lot faster.
Yeah.
And
Mm-hmm.
again, depending on their guidance with the faja, if the faja is too tight, or they don't got foams, or the surgeon said no foams for 2 weeks, or
Mm-hmm.
the
Mm-hmm.
wrong faja, now you've got triple the problem, because now the fluid that didn't come out is pocketing and
It's
hard,
trapped.
and now
And
Yes.
absorption that we wouldn't have had in week two if we would have got rid of it through the incisional.
Right.
Yep.
So,
Right. Can you, Gigi, expound on that? Because I remember one lesson that we did, one of our meetings that we did. You just really kind of broke that down, and you brought to light when you talked about the pockets of fluid and the hardening in those the day 1 through 7 when you don't do incisional. Can you expound on that? Because that was really good information.
Yep.
Well, I don't know exactly what I said. 'Cause that's a lot. I just feel like it's definitely a difference. Now, have I had clients that magically don't have any issues and they didn't have incisional? Yes, but
Right.
most of them do have problems if they don't get enough of it or if we get it out in time. So it's not the one all fix all, but it definitely is a major factor in helping not have those issues. And again, like we said in the meeting, the way you do it and how much you do it is, is super important
Yeah.
to me. So for example, at day 5, if my client's not producing much fluid and, I'm transitioning into the next stage,
Right.
Hmm.
I
Exactly.
Right.
start day 7 at day 5.
Yep.
I kind of decide. And I always tell them, look, we have specific guidelines, but your body talks to me and
Exactly.
Hmm.
I'm going to decide
Hmm.
on. So we're going to have those guidelines, but post-op specialists, our goal is to give you guys the tools to know when to shift gears and when to decide to move on to the next step, stop one thing and start it. So, but again, I have my brain is fried right now, so I don't remember.
Girl, you're
So
killing
just
it
Right.
with a fried brain.
remind me, maybe.
Well,
But
does anybody have anything else that they want to leave with anybody, or any questions you all have before we end our session? Any questions? Any questions you have for us?
I have something really quickly. So I know we spoke on not receiving incisional. So let's talk about when people and clients receive improper incisional.
Mm.
Um,
Mm,
like
yeah.
how does that affect them? And just picking any provider. So
Okay.
those
Yeah.
to
validation
you
too.
know. Um, so yeah,
Yeah.
maybe Adia, you want to touch on that?
So if they have improper treatments,
Hmm.
Hmm.
Yeah.
yeah, I mean, so a lot of clients that come in, they're not educated on postoperative care. They're expecting things like wood therapy. They think that body contour and they think that body contour and post-op are the same thing. So why
Hmm.
are you not using wood tools? Why isn't it aggressive? Or they don't know the difference between cavitation and therapeutic ultrasound, right?
Oh
Right.
my
So
God.
if I know that you've gone somewhere and got cavitation on your first week of surgery, I'm terrified for you
Man.
because essentially you're removing fat cells that are not there anymore.
Hmm.
So then the integrity of the tissue is now affected.
Gone.
Um, yeah, I think really clients need to treat their post-op care and who they pick as like something so important because you go to the wrong person and all the money you spent on your surgery could go down the drain.
Fumble
Not
fast.
only could you get an infection, your results definitely on the line.
Hmm.
And, at the end of the day, a lot of these clients are not just spending money on their surgery, they're taking time off of work, they're risking their health. So
Hmm.
picking your postoperative facility is very important. Do your research. Don't just look for the cheapest price in someone's house.
Please.
Right, right, right.
Make sure that the person is educated. Make sure that they are part of CSL. And
Hmm.
For one.
that's it. Number one.
Right.
Number one, make sure they're part of CSL.
Elite
And if you're
survivor.
not part of CSL, you need to come and join. Um, because we're all held to a higher standard and we're a community.
Hmm.
We talk to each other when we don't know, because you know what, guys, sometimes you're gonna have a client where you don't know,
Right.
Yeah, you got to
or
figure out.
you never seen them before, and that's we're human. But what I love about this community is that we're able to hop on Discord, or now we all talk. Never before would are you able to reach out to a provider across literally the continent and ask a question about something. We all have strengths in different categories of the post-op niche. Some of us specialize in lipo, some of us specialize in tummy tucks, whatever it is, you're able to talk to each other and get an opinion on wound care. What do I do about a faja? And I think having that community is like the biggest piece because at the end of the day, we're all doing the same thing. And the fact that we're able to give our clients better medicine
Hmm.
is the biggest thing because this is
Right.
better medicine. We're technically who the clients spend the majority of their time
Right.
with. And a lot of the times the surgeons are back to doing somebody else
Right.
with another client and we have to take on that baton like Gigi said, right?
Right.
Yes.
And like I said, how many days do you spend with your surgeon? Maybe your pre-op, the day of
Yeah,
surgery, and
like two
maybe,
Some of
days.
them meet them the day of.
but aside
Yeah,
from that, 3 to 12 months. So depending on, picking your surgeon is just as important as picking your post-op
yeah.
provider.
Right.
Even some of us offer consults to help you pick a
Yep,
surgeon because some of these surgeons are on board with the right post-op care, with the right other
yep.
ones. They're just not there yet, but we're getting
They
there.
will be.
So,
They
yeah,
will be. Yeah.
that's our goal, is to bridge that gap, right?
Yep.
And make sure we not only create a community, because before I feel like there was a mean girl environment, not
Yes.
to help people
Yeah.
were trained, or now it's like, okay, this industry is going
Yeah.
somewhere, and some of them are kind of like the pioneers of it. So we're helping and reaching back to help other people that want to do better and be better, and we're all here to help each other. So it's a great community, and I'm really glad to be a part of it. So
That's right. I really enjoyed this
Me too.
conversation tonight, and everybody that's watching. If it's anything that you don't know or you have a question about, CSL provides so many courses. And if you don't know how to do incisional, they have an iMedic course. You can just go to csltherapy.org and register for that. We will be back on here to discuss post-op endure and body
Hmm.
couture. I thank everybody for joining us. Y'all have an incredible night.
Thanks, Crystal.
Peace.
Bye.
Bye.
bye.